Alberta doctors say emergency departments across our province are in crisis mode. Less than 3 weeks after an Edmonton man died waiting for hospital care. Long waits and crowded rooms still punctuate health centres. As Tim Brooke explains, doctors say our emergency care needs emergency help.
John Henn waited 3 full days inside the Peter Lougheed Centre emergency section.
I was counting ceiling tiles. I brought a sociology textbook. I finished it in the first 24 hours, and then after that was just listen to music, I guess.
A boring stay for needed help, but Henn says he's lucky. He actually had a chair to sit and wait in.
It just seemed like they didn't have places to put people, and then all of the upstairs units were full, and that just caused massive backloads downstairs.
Across the streets, Avo Wahlberg is still waiting for his 90-year-old mother who broke her hip.
She's been in the hospital now for 3 days, but it's an emergency in the sense that the physicians feel it should be done within 24 hours.
Doctors tell us it's past time for the province to step in.
Our entire province's healthcare system is in crisis. We need to declare a state of emergency.
Doing so would allow for temporary measures that may improve the system. It could mean emergency funding or load leveling, which would move patients out of busy centers and into facilities that can handle them.
Often, frequently, we have people in 10 out of 10 abdominal pain with no pain medications, no comfort, nowhere to sit comfortably for 12 hours in our emergency department because we can't get them in.
In the last 24 hours, we've seen the queue at Rocky View exceed 5 hours and the one at the South Health Campus reach 8 hours and 20 minutes. At one point, the wait at Peter Lougheed was 10.5 hours. Even those staffing Calgary's fastest emergency department say they're underwater.
So right now today, we're 130% over capacity. We've started doubling up rooms on most of the different floors of the units to handle the increased patient load.
Alberta's minister in charge of hospitals and surgical health services denied a CTV News interview request. A statement says the province will continue to monitor system pressures closely and work with health system partners to respond to challenges as they arise. It adds recent investments in acute and continuing spaces should alleviate some concerns soon, but the government will not commit to declaring that state of emergency. It's not what many doctors want to hear.
I would just respond, how many more patients have to die in our waiting room before they'll step up and show some leadership?
Tim is outside Foothills Hospital tonight. So, Tim, what are the professionals blaming these issues on?
Well, it depends who you ask, Tara. If you ask the province, they'll say a large portion of these problems can be chalked up to an especially bad flu season. And, well, as we all know, that's at least partially true. Influenza has been tough on hospitals this year. We've seen admissions total around 2,200 for the flu this year, which is, or 2,200 more rather this year for the flu than there was last year at this time. So, of course, that is a major problem. But if you ask doctors, there's also other major problems. They point to rapid population growth and what they call chronic underfunding of the system. And they also say clogs in the continuing care system are not helping, Tara, because, well, they're just taking up valuable hospital space.
Okay, Tim, thank you.